I'd like to welcome you to the Frozen Shoulder series, and in this part 5, we're going to be talking about what actually happens, what actually goes on inside your shoulder joint if you have a frozen shoulder. I find this one as a practitioner fascinating, and any of you who are practitioners I think might share that opinion. One of the major contributions of Dr. Neil Asher is that the bicep tendon is intimately involved in the cause and the treatment of frozen shoulder. You see, this tendon can swell when it's involved to about 3 or 4 times its normal size. At the tip of the arrow, you can see a little groove where that bicep tendon should sit neatly and comfortably. With a frozen shoulder, when this tendon swells, it tends to glide back and forth out of that groove. And it's that tendon gliding sideways that gives you that tremendous pain, that deep, achy feeling that seems to penetrate your shoulder and make it impossible to move for several minutes on occasion. And therefore, it's an absolutely essential part of treatment for frozen shoulder as well. So as we mentioned in the previous slide, the bicep tendon can become swollen and inflamed. And this inflammation can follow the bicep tendon up to the top of the shoulder and then follow it as it buries itself deep in the shoulder joint itself. So now there's inflammation everywhere, inside the joint, outside the joint, and it can even go to the rotator cuff muscle tendons, as we see in figure 3. All this inflammation causes pain, and because of that you stop moving the shoulder, and this causes your arm to hang stiff and immobile. If this weren't enough bad news, in number 4, we see that the shoulder is surrounded by a capsule, the shoulder capsule, and this capsule has fluid in it. So the capsule is essentially a water-filled balloon that surrounds the shoulder joint, which keeps the joint lubricated. When you get a frozen shoulder, the fluid is drained out of that balloon. Have you ever seen those commercials where they put food or clothes in a plastic bag and then suck all the air out of them? Well, the same principle applies to the capsule that surrounds the shoulder joint. When the shoulder is injured, the capsule can have less fluid, which in turn shrink wraps your joint. If you suffered from frozen shoulder, this can dramatically decrease your ability to move your shoulder. In fact, it can become very painful to even try. In number 5, this limited motion in the shoulder frequently creates a fertile area for scar tissue to form inside the capsule and inside the joint itself. Scars inside the joint are often called adhesions, and these are seen in number 5. When you hear the word adhesions, think scar tissue. Okay, so now you have a frozen shoulder. Typically in the early stages of frozen shoulder, you're in pain most of the time. You can't even put on or take your clothes off without pain. The rotator cuff muscles of the shoulder become weak and they start to atrophy. You avoid using your arm because of the pain. You can't sleep. You're exhausted. Family and friends want to help, but they get frustrated because they don't know what to do. And as a result, relationships suffer. The bottom line from this is, you're just miserable. You won't die from a frozen shoulder, but it just seems like it sometimes. To protect the organs in our chest, we have many ribs that form a cage, a rib cage. Ribs have many joints, and that allows the cage to bend and twist as we do. You know, in 28 years of practice, every frozen shoulder I treated had stuck ribs. Just like peanut butter and jelly, they kind of go together. With a frozen shoulder, stuck ribs cause pain, usually at the blue areas. The neck always gets stuck on the same side as the frozen shoulder, about halfway up, and this causes you pain at the red area. So in addition to pain in the shoulder joint, you will have pain and spasm at the colored areas as well. So these colored areas must be gently moved, and this decreases your spasm and decreases your pain quickly. I'm just going to make one note for you here. If you start to have a frozen shoulder, or if you think you do, don't stop moving it. Don't put it in a sling. Don't make it immobile. That's the entirely wrong thing to do. It'll make your frozen shoulder much more restricted, and the pain will be much worse. The correct thing to do is to move it as best you can, as often as you can, avoiding only those motions that create that deep, penetrating kind of pain. As long as you're moving your shoulder, even if it's uncomfortable, as long as you don't get that deep, penetrating pain, you're fine. And I encourage you to do that. Dr. Stetson is an MD. He's an orthopedic surgeon. And he says that 50% of patients go on to surgery if they're only treated with physical therapy. Well, we use physical therapy on our patients, but we also use a number of other techniques as well. And there's a reason why our results are so good. 90% experience very good to excellent results, and we're very proud of that. There is a better way, and we're going to tell you a great deal more about that in the next few parts.